Hello everyone, it's Tim Spector here of the Zoe COVID study, and people were a bit upset that I was a bit downbeat last week, so I'm going to try and smile more and bring some reassurance to those who have begun to doubt me. And on the video today we've got several topics. The first is, of course, is the latest data from the Zoe app that you guys have been reporting for us. Then we're going to talk about the rates of long COVID and hospitalisation. We can talk a bit about the risk of COVID at big public gatherings like music festivals. Then we're going to talk about the international numbers, about how the UK is doing there. Look at how vaccines are working over time, and this time start to take a peek at the severity of symptoms, whether they're still protecting us. And finally, of course, we'll give you our update of the top 5 symptoms, and not only in adults who have been vaccinated, but also in children. So let's look at the data this week, shall we? And we're seeing a slight rise in new cases, up to 57,000 nearly per day, and that's slightly more than we saw last week, giving us an R value of between 1 and 1.1. And what's really interesting is that of that number, 17,300 are fully vaccinated, and that number's creeping up to about 30% of all the cases that we're seeing. And that's going to get increasingly large as we go towards the end of the year. Now, if we look at the overall prevalence, your chance of bumping into someone who's currently got symptoms of COVID is back at around 1 in 90, which is still pretty high, and a large proportion of those will also have been double vaccinated. So next time someone sneezes on you, do pay attention, because the risks are going to go up the more people that are around you. And in comparison to the government confirmed cases, of course, we're higher. We don't know how reliable those confirmed cases are because some people aren't getting tested. But the important thing is we are tracking along the same lines, so the trends are still very similar, as you can see. And we're the only UK study looking at number of new cases rather than prevalence, and this is our early warning device. So do keep giving us this information. It really is totally unique. So let's look at the picture across the whole of the UK, and we can see that the southwest, some of those festivals and tourists still going up, the Midlands, Yorkshire, and of course Scotland, that I tweeted about a few days ago, where rates are going up really fast, and it now has rates that are higher than many of the countries that have just been added to the red list, like Montenegro, etc. And this begs the question really about our travel policy. So we're stopping anyone coming in from Montenegro, but actually maybe we should be thinking about internal restrictions if we're going to be consistent, or actually do away with some of these travel policies, which at the moment no one in the government seems to be defending, and is causing a lot of cost to the public and problems of people meeting up with their families, etc. But going back to Scotland, it'll be interesting to see what they do in terms of lockdowns or restrictions, or if the behaviour like the rest of the UK, just sort of hope it's going to go away. And what's interesting is this is mainly driven by kids going back to school. We think it's mainly driven by young people aged under 30 that are causing most of these. And this is something we see all across the UK. If you look at these graphs, it is being driven by still the young rather than the old. And this means that most of the infections we're seeing, although very high rates, are much milder than we saw in previous waves. Let's talk about schools going back and what we can learn from Scotland where about 50% of the infections were really being driven by children. And we can expect to see an increase in young people in England and Wales pretty soon. And what's also interesting is if you compare the rates of England and Scotland over the last few months, we see a distinct pattern, because Scotland had definitely done much better than England until quite recently, when the restrictions on pubs, nightclubs, big gatherings fell away, and you can see a sharp increase in these cases. And I think they've overtaken the England's, but England could rebound, I think, fairly soon. Now, discussing children and whether they should be vaccinated is a key point, and there's a link here to join us on this fascinating webinar that we did a couple of days ago, that you can join in on that debate whether or not to vaccinate our children. Now let's look at the three really important consequences of having large numbers of infections. That is chance of getting long COVID, chance of being hospitalised and going to ICU, and more rarely chances of death. All these three things can occur, and it's important to monitor them as we move into this new phase of milder disease because of the vaccines. And these vaccines are reducing risk of all of these three. But let's just look and see what the latest trends are actually telling us. And if we look at the rates of hospitalisation, the graph from Public Health England tells the story here about rates are gradually increasing, and they are causing pressure in some hospitals already, mainly because we have such low capacity in the NHS compared to other countries. And if we look at our predicted incidence of long COVID, which is all based on the Zoe data, we can see that we're doing still pretty well compared to the second wave, but this is still very high, far too high in my opinion. 949 people a day are getting long COVID. This is going to have consequences for the future of the NHS, and can't just be laughed away, as some people are saying, because we're getting most of our cases in young people. Risk of long COVID, just to remind you, that is the serious type of long COVID that lasts more than 3 months, causes functional problems, is between about 1% and 5% of people, depending on their age and other factors. Bear in mind that hospitalisations have decreased about 2.5 times compared to the last wave relative to the number of cases, but they are rising again. And deaths are the biggest difference we saw since the last wave, which is really important, good news. But there's a lot of variation day to day, as you probably noticed, and we're now reporting the average over the week because each day's data doesn't make a lot of sense. We're currently at around 110 deaths a day, which is, considering it's August, is a lot of people, and obviously is going to accumulate. And this sort of rate hasn't been seen since mid-March. And I'm concerned these rates are rising, and we haven't really understood exactly why, and whether we're going to do anything about it or just accept that this is something that happens. So let's look and see how the UK is doing on the international stage. If we look globally, we can see that rates in the UK of new cases are still one of the highest in the world, and also one of the highest in Europe, despite having pretty much the best vaccination rate. But we are being beaten overall by soaring cases in countries like Montenegro that we discussed, although they have lower rates than some areas of Scotland that have got on into the red list. Now, Spain, Germany, Italy and France are seeing their rates actually coming down now, and it may not be a coincidence that they still have restrictions in place on public meetings, wearing masks, personal hygiene, etc. Now, Israel is the other worrying concern, who are ahead of us in the vaccine race. Remember, they gave the Pfizer jab 3 or 4 weeks apart, which may have been too soon, and they are still seeing rates of cases going up, but also hospitalisations. Now, it's in hospitalisations that I think we see some interesting data, which is in a way perhaps more relevant nowadays. The US is topping that with over 250 daily admissions per million people, and Israel is pretty high in despite its high vaccination rates. But the UK is among the highest in Europe, so it hasn't escaped that hospitalisation that we were hoping for, which again to me is a worry. I'm sorry about that, but it's not climbing at a high rate as it was, so hopefully we might see some signs of decline in the coming days. And as I mentioned last week, there are a few reasons why the UK is performing so badly, in my opinion, despite our high rate of vaccination. One is we have zero COVID restrictions socially. Mask wearing is not commonplace as it is in most other European countries. And we vaccinated early, and as I explained, we are seeing some wearing off of that vaccine effectiveness by about 3 or 4% a month. And I think we've become rather complacent, especially if we're fully vaccinated, and the idea that we thought, in a way, based on data, quite reasonably, that we were perhaps more protected than the reality. And finally, we're not being told the symptoms to be aware of when we get infected, so we're much more likely to infect other people than happens in other countries where they are warned about cold-like symptoms, and for some reason our government is still procrastinating on that. So my advice in this is that really we should be acting sensibly, avoid mass gatherings and crowded places until the government starts to change its mind, enforce some basic safety measures, and enforce some of these regulations. And I think it'd be really interesting to see what Scotland comes up with, that have generally provided independent advice, and they seem to be hitting this increased rate of hospitalisations and cases ahead of the rest of the UK. And I will be keeping my eyes open for what they do next. Let's now look at vaccine effectiveness against severe COVID and hospitalisations. So you remember a couple of weeks ago I shared with you the breaking news that the vaccines were waning for getting any type of new infection, and of course most of those infections were mild, and so some people have said, well, that doesn't really matter much, we can put up with that and live with that, which I'd agree if that was the case. So very important to also look and see what's going on with more severe forms of the disease, or those that bring you to hospital. And when we looked at this data, we are seeing a correlation that the rates are dropping, also similar to the all cases in terms of severe cases, both for hospitalisation cases and severe cases, for example, of very bad shortness of breath. We're still looking at the data. We're not sure whether those differences between, say, 1 month and 4 or 5 months are clinically significant. And of course, the small numbers mean we have slightly less confidence in it. But I wanted to share this with you first, as we're still working on it, just to show that I don't think we can be complacent and believe, as some people are saying, that these vaccines are effective for a year against all severe illness. You don't have to worry at all. So I think it's, as always, likely to be nuanced and somewhere between these. So yes, they are working. We definitely are seeing several-fold reduction in your chances of going to hospital, having severe disease, but we look as if we are going to need top-ups at some point, particularly for the more vulnerable. A quick word about music festivals, which are huge in the UK, and it's certainly a source of great fun for young people who haven't had them for a couple of years in many cases, but they come at a price. And we've seen Latitude Festival, 1,000 cases after the event, and 50,000 odd people went to Boardmasters, and in Cornwall, mainly very young people, and camping together, and over 5,000 cases, probably more. That's at least 10% of the people who went to that concert got infected. And that gives you an idea of the scale of the problem when you do have these large gatherings. And again, some suggestion that merely because it's outdoors doesn't protect you against Delta as much as it might have done some of the earlier variants. This Delta is very clever. And can't blame this totally on the unvaccinated. As we're seeing in the other data, vaccinated people are also transmitting some of this disease, although less. So clearly, we can't pretend that vaccines are 100% effective. They are still causing some disease. We do have to be more clever about this. And vaccination is not a price to freedom. It's a price to much less death and overrunning of the NHS, but it's not 100% as we perhaps previously thought. And I think these super spreading events are going to tell us a lot, and the rest of the world a lot, who haven't been having them. The UK there's a few places in the US, but generally the UK is leading the way in these festivals. We're going to see what's going to happen with the massive Reading and Leeds festivals soon, All Points East in London, and Let's Rock Scotland, which will be generating huge amounts of extra cases, and many of them may go unnoticed, of course. And we've also got Isle of Wight Festival, Wireless Festival, Let's Rock Kent, and we have to realise that the cases will be generated, and there should be much more information for people going to these about the sort of symptoms to expect, etc. Which brings us on to this idea of symptoms. Again, we've found out that about 40% of cases are being missed because they don't have the classic symptoms that the NHS and the government are still banging on about, which have completely changed in the last 6 months. And other governments around the world have moved with the times, still waiting for these guys. So the sensitivity, the ability of those classic symptoms to detect what's going on has really dropped a lot. So just to remind you what these 5 classic ones are, they're now interestingly the same in vaccinated adults as they are in children. So families only need to remember one list, and here they are. Runny nose is the top at 76%, going down to headache, sneezing, sore throat, and the only one of the classic ones, loss of smell, that you guys pointed out to us all those months ago, is at 51%. And we're still, as I said, waiting for the government to take action and tell the wider public who don't listen to these videos or use the app. To wrap up, we are in a state of flux here where we've got to realise this is a new phase, and I don't think we can carry on that same state of complacency as we are before. Doesn't mean things are dreadful. It's important to get this in perspective. NHS is not at the moment being overrun, but we have to be aware of what really is going, and all of us can reduce the number of cases by spreading the word about symptoms and just acting sensibly whilst still enjoying life. We are going to be expanding the app. You'll be hearing from us in a few days to include other health-related diseases we can ask about, because there are 5 million of you waiting for NHS treatments for many of these other ones. And we want to use the experience we've had with COVID to help us fight other common diseases like cancer and dementia in the same way. So thanks again for your support. Stay safe and keep logging and click on those notification buttons. Thank you.